Assalamu alaikum everyone. Today we will discuss about hemostasis. Hemostasis is the physiological process by which a bleeding stops. Its final result is a thrombus formation which consists of blood cells and fibrin strands. Hemostasis we have two types: primary hemostasis and secondary hemostasis. Primary hemostasis we have hemostasis through vessel known as vascular hemostasis, and then we have platelet hemostasis. Vessel hemostasis occurs through transient vasoconstriction and von Willebrand factor activation following injury. Platelet hemostasis is done through the adhesion, activation, and aggregation of the platelet, which result in the formation of platelet plug known as white thrombus. Secondary hemostasis is activation of the coagulation cascade, which result in the formation of fibrin clot known as red thrombus due to RBC within the fibrin clot. So we have primary hemostasis due to platelets and secondary hemostasis occur through coagulation cascade. We have extrinsic pathway of the cascade and extrinsic pathway. Extrinsic pathway involve the factor 3, which is known as tissue factor, and factor 7, while extrinsic is factor 12, factor 11, factor 9, factor 8, and this is common pathway, which is factor 10 along with factor 5, and this is factor 2 known as prothrombin, and this is fibrinogen factor 1. So this is the common pathway, factor 1, 2, 5 and 10, and this is the extrinsic pathway, factor 3 and 7, and this is the intrinsic pathway, which is known as factor 12, 11, 9 and 8. Primary hemostasis is the process involved in the formation of platelet plug white thrombus following injury. Vascular hemostasis we have, and we have platelet hemostasis. Vascular hemostasis endothelial injury result in neuronal stimulation reflexes and endothelin release. Transient vasoconstriction of the vessel occur that leads to reduced blood flow and there is decreased blood loss. Then we have platelet accumulation at the vessel wall. Exposure of the subendothelial collagen leads to the binding of the circulating von Willebrand factor. What is von Willebrand factor? So it's a plasma protein that is synthesized by and stored in an endothelial cell known as Weber platelet bodies and alpha granules of the platelets. Mediates the platelet adhesion and aggregation and binds factor 8 and thereby prevents its degradation. Now we have platelet hemostasis. So in platelet hemostasis we have platelet adhesion, platelet activation, and platelet aggregation. Platelet adhesion, platelets bind to von Willebrand via GP1B receptor at the endothelial injury site. Ristocetin is antibiotic that normally activate von Willebrand factor to bind GP1B. Then we have platelet activation. After binding to von Willebrand factor, platelets change their shape and release mediators that lead to the activation of more platelets, leads to positive feedback. These mediators include ADP, which promotes adhesion of the platelet to endothelium. Then we have thromboxane A2, which activates additional platelets and promote vasoconstriction as well. Then we have calcium, which is required for the secondary hemostasis in the coagulation cascade system. And then we have platelet activating factor, a phospholipid mediator that is produced by the platelets and inflammatory cells like neutrophil, monocytes, macrophages, and lead to the aggregation and adhesion of the platelets. Then we have platelet aggregation, so it is mediated by the GP2B by 3A receptor by which the platelets adhere to one another, and fibrinogen. Formation of white thrombus composed of platelets and fibrinogen. A white thrombus is transient, unstable, and easily dislodged. It stabilizes through the process of secondary hemostasis, which occur by the coagulation cascade. Now we have secondary hemostasis. So secondary hemostasis is a process that leads to stabilization of the platelet plug white thrombus by creating a fibrin network. Coagulation cascade. What is coagulation cascade? It's a sequence of events triggered by the activation of intrinsic or extrinsic pathway of coagulation that result in the formation of stable thrombus. What are the coagulation factors? These are the substances that interact with each other to promote blood coagulation, and alphabet A is used with the factor to show that the factor is activated. Like with factor 7, A is written, it means it is activated factor 7. We have extrinsic pathway of coagulation and intrinsic pathway of coagulation. Extrinsic pathway is triggered by endothelial injury. So tissue factor is releases and activates factor 7. Tissue factor expressed on the surface of subendothelial muscle cell and fibroblasts. Factor 7, which is vitamin K dependent coagulation factor produced by the liver. Then activated factor 7 and tissue factor form a complex. These steps require calcium found on the surface of the fibrocyte and activated platelets. This complex activates factor 10 and factor 9. Then we have intrinsic pathway of coagulation. So exposed collagen, kallikrein and kininogen activates factor 12. Factor 12 known as Heckman factor, so that's the play a role in inflammatory response by activating the kallikrein system, which lead to the production of bradykinin and activated factor 12 then activates factor 11. So factor 12 is activated, which activates factor 11. Thrombin, which is activated factor 2, activates factor 11 and factor 8. So thrombin activates factor 11 and factor 8, and activated factor 11, which is activated by factor 12, in response activates factor 9. Activated factor 8 and activated factor 9 form a complex that activates factor 10. This causes a positive feedback loop of factor 10 and thrombin activation via intrinsic pathway. Then we have common pathway, so the extrinsic and intrinsic pathway both end in a common pathway. Activated factor 10 and activated factor 5 form a complex mediated by calcium that cleaves prothrombin factor 2 to activated factor 2 known as thrombin. Thrombin cleaves fibrinogen factor 1 to activated factor 1 known as fibrin. Cross-link of the fibrin network are stabilized by factor 30, activated factor 13, and formation of a fibrin network. Fibrin closely binds to the platelet plug, forming a stable thrombus, which is known as secondary thrombus or red thrombus. This is a table which shows different type of factors. This is the factor number and this is the descriptive name. And this symbol show that this is the preferred term for the factor, and this symbol show that this is least preferred or not much preferred. So activated factor 1 preferred term is fibrinogen, for factor 2 prothrombin, for factor 3 tissue factor, while for the factor 4 it's calcium, factor 5 procalcirine. So here it's not preferred term is factor 5. Then we have factor 7, factor 8, factor 9, factor 10, factor 11, factor 12 and factor 13. These all are the preferred term as compared to these. So this means that this is the preferred term while this is rarely used term. So fibrinogen is activated by thrombin, prothrombin is activated by activated factor 10 and 5 complex, tissue factor is activated by the endothelial injury, calcium is activated or released by the platelets and fibrocytes in response to the injury, then factor 5 is activated by the thrombin. Factor 7 is activated by tissue factor, factor 8 by the thrombin, factor 9 by the activated factor 11, factor 10 by the complexes of the factor 7, activated factor tissue factor and activated factor 7 in the extrinsic pathway, while activated factor 8 and activated factor 9 complex in the intrinsic pathway. Factor 11 is activated by the activated factor 12 and thrombin. Factor 12 is activated by the exposed collagen, kallikrein or kininogen molecule, and factor 13 is activated by as well by the thrombin. Then we have involvement of the pathways. So in common pathway we have factor 1, factor 2, factor 4, factor 5 and factor 10. Intrinsic pathway we have factor 2, factor 4, factor 8, factor 9, factor 11, factor 12. In extrinsic pathway we have factor 2, factor 3, factor 4 and factor 7. And these are the function of different factors. This is the image showing the two pathways, extrinsic pathway and intrinsic pathway, and this one is the common pathway, factor 10 and factor 5. Extrinsic pathway, so tissue factor, factor 3 activates factor 7 and activated factor 7 along with factor 5 activates the factor 10, which leads to activated factor. Then activated factor 10 and factor 5 converts prothrombin into the thrombin, which converts fibrinogen into fibrin and leads to cross-link fibrin, so fibrin clot is formed. Intrinsic pathways, so first we have factor 12 which is activated factor 12, and this factor in turn activate the factor 11. This activated factor 11 in turn activates factor 9 to activated factor 9, and thrombin activates factor 5, factor 8 and factor 11. So factor 11 is activated by factor 12 as well as by thrombin. Now we have activated factor 9 and factor 8. These form a complex and they activate factor 10, which is converted into activated form of the factor 10. This activated factor 10 along with activated factor 5, which is activated by thrombin, form a complex and convert prothrombin into the thrombin. Thrombin convert fibrinogen into fibrin and it leads to cross-link fibrin. Thrombin also activates factor 13, which leads to stabilization of this cross-link. So this cycle continues. Thrombin activates this factor activates and continue to convert prothrombin into the thrombin, and again this cycle continue and leads to the fibrin clot formation. The coagulation cascade requires the presence of calcium ion known as factor 4. A helpful way of remembering coagulation factor of the extrinsic pathway is 3 plus 7 equal to 10, while for the common pathway 10 by 5 equal to 2 multiplied by 1. Inhibition of hemostasis. So in order to prevent hypercoagulability as well as excessive bleeding, activation of coagulation cascade and the process of that inhibited occur simultaneously. Like procoagulant and anticoagulant, both pathways occur simultaneously. We have tissue factor pathway inhibitor which inhibit tissue factor. We have protein C and protein S. So activated protein C and its cofactor protein S form the activated protein C complex, APC complex, which inhibits factor 5 and factor 8. So it inhibits activated factor 5 and 8 and prevent the process of coagulation. This is vitamin K dependent synthesis in the liver, short half-life than vitamin K dependent factors. And clinical relevance, we can have APC resistance, factor 5 latent and protein C as deficiency leading to hypercoagulability. Then we have another factor antithrombin, which degrade thrombin and activated factor 9 and factor 10. It activates tissue plasminogen activator, which leads to the formation of plasmin and breaks the clots. Clinical relevance, so antithrombin 3 deficiency due to liver or kidney failure can lead to hypercoagulation. Then we have non-specific inhibitor like protease inhibitor in the plasma. For example, alpha-1 antitrypsin, alpha-2 macroglobulin. Then we can have drug induced like anticoagulant and others like protein Z, which is factor 10 inhibitor, heparin like GAGs, which boosts antithrombin, and heparin factor 2, which require heparin for the activation. Disease that affect the inhibitor of coagulation cascade may lead to hypercoagulability. So that's all about hemostasis.